Welcome back to the Better Health Now podcast. We actually have a familiar face back on the podcast. Welcome back, Dr. Licata, to the podcast. Well, thank you so much for joining us.
Thanks for having me back.
Yeah, I'm excited to kind of talk a little bit about the summer heat and keeping children safe in the summer. When we first had you on, we talked a little bit about your background. So if anyone missed that episode, definitely go check that out. It'll be linked below so you can learn a little bit more about you. But diving right into the conversation, what are some of the concerns that parents should have in the summer heat? I mean, anyone that's listening to this, we've gotten a lot of heat, summer heat here in Alabama, in northern Alabama right now. What are some of the things that parents should be aware of when keeping children safe?
Yeah, I think a few of the big topics, the issues, the conditions that come up when we get to the summertime is really how do you keep yourself safe in the sun? How do you keep yourself safe with water? And then how do you keep yourself safe in terms of injury prevention? Those would be the big areas that we would talk about in the office.
And then so diving into let's talk first about kind of dehydration.
Okay.
Talk a little bit about what parents should be watching for and what are some signs that their children is experiencing dehydration.
Yeah, so that's definitely a concern as the temperatures get hotter outside, because what our bodies do to try to cool off is they try to sweat. So they lose fluid, they lose electrolytes. And so sort of preparing the body for that extra exposure to the sun and then that increased fluid loss. Hydration is really important, and children actually get dehydrated easier or more quickly than adults. They don't have as much reserve as adults do. And so a few of the tips and tricks that I would provide for parents is really plan ahead. So yes, it's going to be hot today, but could we get out in the morning or in the evening when maybe the UV index is not quite as high? Making sure that you dress your child appropriately. So loose fitting, though still probably cotton clothing that can breathe a little bit, can make the child more comfortable and allow for easier evaporation of sweat. And then really watching your child and making sure that you can proactively encourage them to take breaks. When are they starting to slow down a little bit? When have you noticed that they're not going to the bathroom as frequently? What can you do to remove them from the heat, get them to a cool place, remind them to drink water that hopefully you have brought with you? Those can definitely prevent some of the signs of dehydration that we see. You also asked, what are those signs and how might we know that a child is becoming dehydrated? It really starts with thirst. So they start to realize that, hey, my body's losing water. I think I might be thirsty. Then you'll notice that they will urinate less frequently. Maybe we see that more easily for babies who have diapers, but older children usually run off to the bathroom every now and then during PE or recess or at the playground. So looking for that too. And then often a lightheadedness, a headache, a little bit of fatigue, and as I mentioned, slowing down. Those would be the signs of, okay, maybe I need to replenish and rehydrate my child.
And so I know that there's always recommendations on for adults, like how much water they should be intaking on a daily basis. Is there a recommendation, especially in this heat? I mean, even for adults, I mean, it's hard enough just to often remember to bring water for myself, but bringing it for your children, is there a recommendation on how much a child should be drinking fluids to kind of, especially if they're going to be out in the heat at summer camps, at the playground, at friends' backyard, at the pool? Is there like a recommendation that you would give to the parents as far as how much water they should be having their child consume?
Yeah, that's a great question. The first and easiest answer to that is more than you think. And then the second way that we kind of come up with those numbers, as in most things pediatric, it's weight-based. So the dose of your medication, also the amount of water that you should drink. So there's not quite a perfect science to it, but the way that we estimate, say, in the hospital for how many IV fluids a child needs, that can then be translated to how many fluid ounces of water do you need. So one easy rule of thumb is the baseline for most children would be half of their weight in ounces compared to pounds. So if you have a 100-pound child, 50 ounces of water, which is quite a lot, would be their good amount of water to drink in a day. So if you can kind of take that as a rule of thumb, you can scale it up or scale it down to match your child.
Yeah, and I mean, I can't imagine trying to navigate that as far as, like, especially if you have multiple kids, it's like trying to make sure that they all drink water, and in the heat of the moment, and obviously in the heat of being outside, it's a hard thing to remember. They don't want to stop playing, they don't want to stop having fun, but you don't want to make sure that there's no health concerns with them continuing these activities. Kind of separate from dehydration, heat stroke and heat exhaustion, they are different. Can you explain those conditions and kind of how they can affect children?
Yeah. So I would say that there is a spectrum of the body's response to excessive heat. So when you are out in the hotter temperatures, as I mentioned, your body's going to try to sweat to cool yourself off. At the extremes of that sweating or the length of your heat exposure, that's when we can run into heat exhaustion. And actually, before that, most adults and some children will notice that cramps come first. So muscle cramps, either in the calf or the thigh, or actually in kids, we commonly see it in the stomach. So they'll get a little bit of GI distress, and that can be your first sign that our fluid balance is off. Heat exhaustion is characterized by profuse sweating and then some additional symptoms that are more severe than just dehydration. So they haven't fainted yet, but they've gotten significantly lightheaded. They don't have a fever, which is a sign of heat stroke, but their temperature is starting to fluctuate. You can start to tell that the body's no longer able to maintain its internal temperature. Heat stroke is the extreme of that spectrum, and that's really where medical help is needed. You can't typically manage that with just rest, a cool place, and increased water, but heat stroke usually has a fever associated with it, fainting potentially associated with it, and then coma and shock being the severe ends of that spectrum. So it starts with a little bit of dehydration, which typically leads to cramps, and then you get profuse sweating. And not that your body is out of fluid, but one of the hallmarks of heat stroke is that you don't see as much sweat as you might expect.
Interesting. And so, I mean, it's for anyone in this heat right now, getting in and out of your car and traveling and having your car sit for long periods of time at work or at the park or wherever it might be. I mean, hot cars are a big issue at this time of year. What are some of the ways parents can keep their kids safe in the car, and maybe things that they might forget when they have their children with them?
Yeah, that's a great question. And one of the things that we have learned is actually starting the car early, turning on the AC. Those types of precautions can only do so much to combat extreme heat. So I have actually found, just a brief anecdote, on my toddler son's car seat, they have buckle pockets so that you can hide the metal from the sun. So those are small things that you can look out for. But more specifically to your question of how to keep children safe is really to try to stick to a routine where you make sure that you don't leave them in the car accidentally. So one way that I like to recommend doing that is actually starting to get in the habit when you're alone in the car by putting your phone or your purse or your bag or backpack in the back seat, so that now that when you get out, you are already in the habit of, I need to reach back, I need to look back to grab my belongings before I get out. And of course, if a child's in a car seat or strapped in the back, you'll see them too at the same time. So making sure that you don't leave them in the car, trying to put something into practice so that you can get in the habit of doing that. And then one interesting point on this topic too is that a percentage, about a quarter of the deaths that occur in children from heat exhaustion or heat stroke when being left in the car is because they accidentally got in an unlocked car and locked themselves in. So one of the other tips that we like to give is, even as comfortable as you might be in your neighborhood, or as obviously safe your car might be in your garage, it's really important that you lock your car anytime you're not in it, just so that that curious child doesn't venture in and then get themselves stuck. They can't get out.
Yeah, and a big part of this time of year is families taking their children to the pool, getting them out. It's a great activity for the parents to, get some sun, hang out with other families, be having some activity, but also trying to stay cool. But with that comes the concerns of making sure children are equipped to get in the pool and swim and know things to keep them safe when they're in the water. Talk a little bit about maybe when's the right time for parents to teach water safety. Is there a time that's too early, or can it not be too early? And kind of what are some things that parents should be aware of if even if their children maybe have gone through water safety and or if they feel as though they are ready to go? What are some things they should still be aware of if their child might be struggling in the water?
Yeah. So I hate to be the bearer of bad news, but sometimes as pediatricians, we have to give it to you straight. And so I do like to mention with this topic that unfortunately, drowning is actually the leading cause of death in children age 1 to 4. And so that's the critical period where, of course, you're not probably going to see a 3-year-old in the lap pool learning freestyle and breaststroke, but can they learn enough survival skills to actually, as they call it in some of the toddler swim lessons, the flip and float?
Yeah.
That's the goal. Now, there are steps before that that we term water competency, and really it just has to do with being comfortable around water. So really, for the parent, that can start at bath time. Of course, having constant supervision of the child, but allowing them to have their head under the water when you're washing their hair, out seeing how they react and how they respond. And then when it comes to swim lessons, this is another kind of touchy topic because there is this new wave of the infant survival skills. However, at least what we show in the research is that the risk of drowning has not been shown yet to be reduced until starting swim lessons at the age of 1 year.
Wow.
So not to say that there's not some validity and benefit to those infant classes. Again, I would say that it's more about comfort around water, but still it's really the parent's responsibility to keep the child safe at that age. When they get older, really when they're starting to walk, because the accident's going to happen, that the child's going to walk themselves into the pool, that's when you should start swim lessons. And again, that swim lesson is not necessarily to teach them to swim. That swim lesson is to teach them to flip and float and be comfortable enough around water to keep themselves safe.
Yeah. And so before we kind of dive into sort of the topics of injuries in the summertime, looking at the areas of dehydration, heat stroke, and exhaustion, water safety, what are maybe some things that we maybe haven't discussed, or maybe just some small things that parents maybe overlook when they're looking at, that area of concern with the heat outside?
Yeah. So first, I always like to say that I understand that parents are doing the best that they can, right? But one of the areas that I think they maybe underestimate their influence and perhaps overlook in terms of safety is how important modeling the proper behavior can be. So, of course, teaching boundaries. Don't run by the pool. Well, the parent shouldn't do that either. Wearing a hat when you go outside. Trying to only mow the lawn instead of 3 o'clock in the afternoon. You do it at 7 in the morning or 7 at night, just to show your child that you're trying to be safe around the heat. When we get to a few later topics in terms of sunscreen and bug spray, the same thing applies. If the parent does it and they can model that behavior, the child usually follows suit. So that also is important in terms of water breaks and rests and how much exertion and how hard are you going to push yourself. Modeling that behavior can be really, really important.
Yeah. And so as the summertime comes, there's a lot more activities that children are a part of. It's this sports camps we talked about. It's the hiking, it's the biking, it's the rollerblading, it's all the things outside that kids love to do because they're in the summer. And it's like, what else are you going to do? You're going to do all these fun activities with friends. What are some of the common injuries that you see in children when they come in? And what are maybe some things that parents can do to maybe help prevent the injuries without taking away fun for the kids?
Yeah. Yeah, that's a good question. And that's a common thing we have to do in pediatrics is sort of walk that line between kind of coming down hard on the child and telling them they can't do something versus how can we set you up for success so that you can still continue to participate. So when it comes to the most common injuries, I would say that broken bones are up there. Concussions tend to occur. That's also kind of during fall football practice and play, but summertime accidents as well. And then we do run into more falls, more burns, and actually more insect and spider bites. Again, that outdoor exposure. So those would be some of the more common injuries that we see.
Yeah. And so you alluded to it earlier, kind of talking about the sun safety and the importance of sunscreen.
Yeah.
Should parents be concerned about any of the chemicals in sunscreen and bug sprays? And what are some of the ages recommendations for children to have these things put onto their skin?
Yeah. So we definitely start that conversation about safe sun exposure when a baby is very young. And part of that is really trying to limit direct sunlight exposure. And so when we cross that line into, okay, when do we want to take our child more out into the sun? And when is their skin safe for the application of sunscreen? It actually starts, we think, around 6 months of age. So there's not going to be peeling skin of a newborn. You're not going to have cradle cap and hopefully not significant eczema. And so the period of most sensitive skin is probably behind you. And so we do recommend sunscreen for prolonged daylight or sun exposure after the age of 6 months. When it comes to the safety of sunscreen, I have to admit that this is one topic where there are so many different brands, so many new products. Just like with diapers and wipes and bug spray, it's hard for us to really keep up with all of the latest technology. However, we do know the basics of what we like to see, not only in terms of safety regulations and recommendations, but also what sort of key terms are you looking for on the packaging and on the marketing. And so some of the things that you would look for are water resistant or water repellent sunscreen, similar to makeup that you don't want to run off in the heat. Sunscreen, you want one application to last as long as it can. And then also broad spectrum. So you're actually trying to cover for different wavelengths of UV light. And so there's UVA and there's UVB. And so broad spectrum is covering both of those UV rays from the sun. And then finally, one of the ingredients, and there are probably more, but one of the ingredients that we have tried to avoid, and I actually have to reference my notes for this one, but it's called oxybenzone. And that ingredient is found in some sunscreen or sun repellents, and it has been shown to have potential hormonal effects. And so, irregardless of the child's age, it's important to try to avoid that ingredient.
Yeah, and so we've talked about an assortment of things that parents could be aware of, ways to prevent the heat and keeping children safe in the summer. Is there any areas that maybe we haven't covered? Anything else you want to leave with maybe the parents that are listening that we haven't addressed already?
Yeah, I think we've talked about, again, a bunch of great topics, and I would just add to the sunscreen conversation. I think you mentioned bug spray, but I didn't get a chance to put in a good answer on that. That can actually start even younger. So, of course, just like when we're applying anything to a child's skin or body, we want to try to avoid the eyes, avoid the nose, avoid the mouth. But after the age of 2 months, you can put bug spray on a child's skin. And this, again, the topic comes up of what chemicals to avoid and what natural ingredients to try to apply. And so DEET is a very hot topic, and yes, it can be dangerous at high concentrations, and seizures is probably what parents will find when they Google it, but the percentage of between 10 and 30% can be effective for, again, any age after 2 months. So that would be the last topic that I don't think we had a full chance to cover.
Yeah, well, I appreciate you being here today. We'll be sure to have everything in the episode notes, information of things we've addressed, opportunities for people if they're listening and they have questions, where they can reach out and kind of ask and get feedback on maybe things that we haven't discussed, or maybe there's areas and concerns that they have that maybe we're not aware of yet. But I appreciate you being here today.
No problem. And just one more thing, if you don't mind, I'd like to empower parents, and I want to tell them that almost all of the information that I've provided today can be found online at healthychildren.org. It's an AAP-sponsored website that's really up to date, and it has all of the latest and greatest recommendations on these topics and much more.
And we'll be sure to have that link in the episode notes, but thank you again for being here.
No problem. Thank you for having me.